You're welcome to my channel. Today I'll be talking about a very common topic that we are all familiar with right now, and that is coronavirus. And specifically, I'll be talking about 2019 novel coronavirus. This presentation is my second edition on this topic, and the reason is our knowledge about this virus is evolving. So I promise to be bringing you up-to-date info. And today, we'll let you know, like I've said earlier, that this virus has been ravaging a city called Wuhan in Hubei province in China, and is still there up to now, and spreading from that to other parts of the world. The knowledge is evolving, like I've said, it's spreading very fast. Mortality is actually increasing. The Chinese government are doing all they could do, and other governments around the world are also trying to curtail the menace. Education is vital. What I'm going to do here is to give you the education about this virus, including prevention. I'm going to add new info to those who are listening to my first edition. You will find some pieces of info right now that are new. I will continue to do this as we continue to get more and more pieces of info about this virus. My thoughts and prayers will be with all the affected people, including those families who have lost loved ones, those that are quarantined, because it's not easy to be caged in an enclosure for weeks. And of course, the good and kind-hearted people, the healthcare providers, who will also be at risk. So, with this in mind, let's go. Okay, before now, I have said that incubation period is 14 days. But from the new pieces of info we're gathering around the world, including World Health Organization and Center for Disease Control in US, it appears that incubation period seems to be between 2 days to 14 days. From 2 days to 14 days. So if you're afraid, maybe you visited China or somebody from Wuhan, China has visited you, or from Taiwan, Hong Kong, Korea, Japan, other places where this virus has reached right now, if you are worried, 2 days to 14 days should be enough to know. And that is what it will take to quarantine anyone. By the time you get to third week and you are having no symptoms, then you should be fine. Coronaviruses, they are medium size, so not big, not small. They are envelope positive stranded ribonucleic acid. They are crown-like in appearance under electron micrograph. They are found everywhere. That is why they are called community-acquired coronaviruses. It occurs mostly in wintertime, but infections can actually occur at any time of the year. It's clinically diagnosed, but you can run some laboratory investigations to be 100% certain. The treatment that you can administer is only supportive. There's a specific type of coronavirus that is causing problems right now, and that is 2019 novel coronavirus that is currently ravaging Wuhan, Hubei province in China. It started in 2019, end of the year, and is still on at present as I speak as of today, and is spreading to other Asian countries with few cases shown in North America and other parts of the world. It is associated with seafood market. Human-to-human transmission has been confirmed, though not very common. The 2019 novel coronavirus in Wuhan is a beta coronavirus. Incubation period known now to be between 2 days to 14 days. That is from World Health Organization and Center for Disease Control in US. If anyone has been diagnosed with this, it is mandatory to report to the public health centers in your jurisdiction because the government must know and follow up. High protection is very essential. And I need to say again that though this is the second edition, but our understanding of 2019 coronavirus is still evolving. But the details of the virology will be for another day. To make the diagnosis, we can take the sputum from the affected person and run polymerase chain reaction. If the person cannot expectorate, perhaps because he or she is too young for that or debilitating, very sick, you can have trachea aspirate. You can also have nasopharyngeal swab. Bronchoalveolar lavage is possible, and stools for reverse transcriptase polymerase chain reaction is possible. You can do the lumbar puncture, get cerebrospinal fluid. Immunofluorescence antigen detection assays is also possible. Tissue culture is, however, very difficult, but you can have oropharyngeal swab as well for polymerase chain reaction. What are the possible differential diagnoses? Because everybody is scared right now, right? So it's not everyone who will come down with the symptoms that I'll be mentioning very soon that will actually be having 2019 novel coronavirus. It might be rhinovirus, influenza virus, respiratory syncytial virus, Middle East respiratory syndrome coronavirus, or severe acute respiratory syndrome coronavirus. What are the possible symptoms? So when you suspect anyone arriving from China with the following, then you might be curious what's going on. So quickly run to your doctor. Community-acquired human coronavirus will present with nasal congestion, just like flu-like symptoms, right? Nasal congestion, runny nose, middle ear fusion is possible, and otitis media, particularly in children, pneumonia, if it is an individual with immunocompromised state, like someone who had transplant, diabetes mellitus, HIV, on chemotherapy, on steroid for a long period of time, malnourished, and so on. Influenza-like illness, acute exacerbation of chronic bronchitis, was with those with comorbidities like congenital anomalies, heart and lung diseases, COPD exacerbations, and CRU. Bronchiolitis obliterans syndrome, diarrhea in infants, necrotizing enterocolitis in newborn, nausea, vomiting, abdominal pain, fever, chills, headache, myalgia, generalized encephalitis, with or without multiple sclerosis. Still on symptoms, it could be associated with Kawasaki disease, though that is not proven yet. The individual could be coughing, sneezing, and so on. I mean, forming respiratory droplets. They could have breathing difficulty, and when X-ray is done, There's likelihood of infiltrate bilaterally on chest X-ray. But is all this? It could be asymptomatic in some, and some will have mild symptoms, while some will have severe situations. And when it is severe, it could lead to respiratory failure, septic shock, and death. Treatment, no treatment, but supportive, so symptomatic treatment. Just mouth fluid, take Annular, Advil. Chloroquine is not yet established in humans, still being tested in animals to handle this. Finally, although I'm going to tag this as the most important out of everything that I've said before now, and that is prevention. This disease will spread through droplets. Therefore, eye protection is very, very important. Let there be hand washing. Of course, the healthcare providers that will be attending to affected people, they've already known that. Cover your cough, cover your sneezes. Dispose properly any item that has ever been in contact with anyone affected or suspected or already diagnosed. You can use chlorozanil, benzalkonium chloride, chlorhexidine to clean. Vaccination would be good, but still on the way, not yet here right now. In case you find yourself on your way to Wuhan in Hubei province in China or some other parts of the world where the disease has been diagnosed and some people already being treated, avoid animal droppings, please. No raw meats, no undercooked meats. Avoid dead animals, and you should avoid playing with live animals as well. You are not expected to make any farm trips, and you are not expected to visit abattoirs. Remember, fatality is rising, therefore we need to be careful. And with that, I've come to the end of this very presentation. I promise, once I have any new pieces of info, I will gladly publish that and do that very quickly. So remember to subscribe to my channel so that you'll be able to get this presentation and other pieces of info immediately they are published. Thanks, I appreciate it.